So, and also, I mean, people that watch this may also start to notice that, you know, all these subtypes and trigger events and all these different things that I'm talking about, this is complex. You know, it really...
It sounds it to me.
You know, as we mentioned at the start, people are very used to having a specific thing for a specific pill to then get better. And with all these different things that are going on, it takes... I remember you once used the term, it's like being a detective. And people have to take that approach. But there are answers. The fatigue that most people with chronic fatigue and ME experience, there has to be, and there are, biochemical reasons why that's happening. Yeah, and without going into too much biochemistry, because it's not my area of expertise, that there's the production of energy on a cellular level. And if the body is not reproducing energy efficiently, of course, we're going to start feeling fatigue. And this also explains people that are watching this that do have ME or know people with ME, quite a difficult symptom to understand until you see it in this way, is the delayed fatigue people will experience. So somebody can be doing a certain thing and they're aware they're kind of pushing it, but they're kind of okay. And then it hits them 2 days afterwards. And suddenly 2 days afterwards, it's like somebody's just taken the plug out of that and the energy just disappears. And this is because the body is not recycling ATP efficiently, ATP being the raw ingredient of energy. And when they crash, it then takes a while for the body to then rebuild that cycle. And what this shows us is that there are physical explanations of the symptoms that are going on. The trouble is that it's different things are different people in different ways, and that's what makes it so complex.
Yeah, and as you were saying earlier, there's also psychological input that's causing those physical reasons as well. Yeah,
to kind of try and simplify a little bit of all this information that we've been talking about, you've got the predisposing factors. So you've got your things that are going on prior to developing ME, and if you just had those, you may well never develop ME or chronic fatigue anyway. What you might have, though, is a bit more fatigue than most people. You know, we certainly talked about that. You know, it might be that someone is always placing other people's needs first, like with the helper subtype. And they do that long enough that after a while, their body's getting more and more diminished. And at that point, if their way of being in the world is to help others, often they'll start to help others more because that's what they're used to doing.
Yeah, so what a helper needs to do is not only help other people, but also to help themselves sometimes.
Yeah, I mean, the intellectual answer to that is that to help others, you have to have the resources to do it.
Yes.
But that's a very difficult thing for someone to learn to live in their life. So we've got these predisposing factors, and then for a percentage of people, there's some kind of trigger event that happens, and we talked about things like a vaccination or a big event in their life, and that causes the system to crash. But then you've got these perpetuating factors that we've also been talking about, and one of these being this maladaptive stress response. We've got this whole new stress and anxiety of being ill and struggling to get through the day, and trying to explain to people what's happening and thinking, you know, there's all these different ideas of what I should be doing. Should I be resting? Should I be pushing myself through it? You know, I've been put on this special diet and I can't get the food. You know, all this stuff that can start to go on. And also at this point, it's like the system crashes. And when it crashes, it's like there's just nothing left to reboot it. And it requires energy to heal. So if we're stuck in this stress state, there's no resources to start to heal and repair the damage of what's been going on. In terms of what we do about it, we've obviously talked about it.
Well, I was also interested in kind of how you dealt with this in your situation. I know some of it's in your book, but how did you deal with all this?
Initially not very well, but after several years of just being completely lost, completely overwhelmed and struggling to kind of keep going with my life, I realised that if things were going to change, then I would have to do something to change them. And spent 5 years for myself, consistently and at times obsessively, researching health, psychology, nutrition, meditation, anything that I thought could make a difference.
So you had to build your own picture of where you had to work out where you were didn't necessarily have the answers how to change that. You had to work that out through doing a lot of research.
Yeah. I mean, things that...
But you were motivated because you desperately wanted to get well.
Yeah.
And that's sometimes a starting point. We don't want to be desperate. When we're desperate, we're more willing to do something about the situation.
There's a huge amount of power that comes from desperation. And it's not just in ME, we see it in all areas of life. But with that, effectively the way that I saw it, which in hindsight was quite black and white and maybe was part of the problem, was that my life wasn't worth living till I was well. Now, I'm not sure that was a particularly helpful way to look at it in some ways, because it meant that I was always stressed anytime I got a symptom. But it certainly drove a constant need to find answers. Things that took me 2, 3, 4 years to shift, these days with the huge advancement in treatments, both in the clinic that I run, but also other clinics around the world that are doing kind of similar kinds of work, that can change a lot more easily. After 5 years of studying and researching in those ways, and I think I saw 35, 40 different practitioners from all kinds of different areas. I think at one point I was taking 70 supplements a day.
Right.
And I was, doing all kinds of things like meditation, yoga to help with.
So it was trial and error to a large degree.
Yeah, absolutely.
And what you're saying now is that partly through what you've done, your own organisation, your own clinic, but also other people have done, there's a lot more actual practical information and analysis that people can find.
Yeah. What I see happening is lots of practitioners, clinics and experts seeing so many more people with ME and chronic fatigue these days that it's driving people to research and understand it more. What we do very well as a clinic is we look at what everyone's doing and try and pull it together in an integrative way which takes the best of different treatments. And as I said before, there are reasons why people are ill, and there are treatments that work to get people better. But even now, I'd be lying if I said to you that there's a magic answer that people come in and we do this and everyone actually gets better. There are some patients which are still challenging to work with. But certainly for us as a clinic, they're the ones we learn the most from. And that's where often new discoveries and new ideas come from, when you've got somebody where you've done the things which generally would make a difference and they haven't. And that's from a scientific approach, what throughout history has driven new discoveries. And it's a lot like being a detective, of trying to find out what is going on.
Is there ever a hopeless case?
There are cases which, they're less and less, but yeah, there are cases of people we've treated for 2 or 3 years, and we're still having to learn and find out what's going on. Yeah. The interesting thing is that most people that come to us have tried a lot of different treatments before that haven't worked. So most people come in thinking they're going to be the hopeless case. Yeah. And that's actually not true for the majority of people.
I think what I'm getting more and more from this is that, again, as we've covered this ground to some extent, that people want to go to someone and that someone provide the answer. You do this, you do that, take this, maybe do a little bit of meditation, take life a bit quieter, take these supplements, change your diet, everything's hunky-dory. But of course, that can work, that protocol, but the next person that comes in to see you might be a completely different protocol. Yeah. And
to be frank about it, it's not helped by practitioners, because the reality is practitioners' livelihoods is dependent upon having patients and treating them. Yeah. And, if you go to a butcher and you say, what shall I have for dinner tonight? They're going to sell you meat. If you go to a vegetarian cafe, they're going to sell you vegetables. Yeah. Practitioners generally see the world through their model of how they see it. And therefore, if you go to a certain practitioner for certain therapy, they'll see it through their model, and they'll gather lots of information that their model is the model, because that's how they're seeing it. What we try to do is look at all the different models and try and pull the best together. And the Optimum Health Clinic's been going 5 years. It's treated several thousand people in over 20, 25 countries. But it's still very new in terms of developing these ideas, and it's very exciting. But it's a big project to understand.
Yeah.